The intention of this standard is to ensure that consumers receive comprehensive care. That is, the coordinated delivery of the total health care required or requested by a consumer. This care is aligned with the consumer's expressed goals of care and healthcare needs. The care considers the effect of the consumer's health issues on their life and well-being, and is clinically appropriate. To ensure that risks of harm for the consumer during health care are prevented and managed, clinicians identify consumers at risk of specific harm during health care by applying the screening and assessment processes required in this standard. There are 4 criteria that underpin this standard: clinical governance and quality improvement to support comprehensive care, developing the comprehensive care plan, delivering comprehensive care, and minimizing patient harm. There are 36 actions or activities that our service has to have in place to meet this standard. This includes specific actions around the minimization of harm from pressure injuries, falls, poor nutrition and malnutrition, cognitive impairment, unpredictable behaviors, and restrictive practices. Let's look at some of the questions that the assessors may ask to determine if we are meeting this standard. How does your service ensure the delivery of comprehensive care?
We have policies that provide guidance on our screening and assessment process. We have training in these screening and assessment tools, and I can show you the results of this training.
Using the YES survey, we review the consumer's views on our delivery of comprehensive care, ensuring that consumers are involved in the care planning process.
Our service has a commitment to multidisciplinary practice, and I can show you minutes of multidisciplinary review meetings and evidence of consumer involvement in that process.
How do you go about improving the delivery of comprehensive care?
We audit the medical record to ensure that our risk assessments and other screening tools are being used. Also, that action plans are developed, if audit results are below what is expected.
We also review incidents to determine if they are the result of failures in the delivery of comprehensive care.
Can you describe how a comprehensive care plan is developed?
We are committed to the delivery of consumer-centered care, so the care plan development process is guided by the consumer's needs.
We have policies that outline the process of development of comprehensive care plans. Also, our job descriptions include the need for the delivery of comprehensive care that involves the consumer.
Our admission documentation includes identification of Aboriginal and Torres Strait Islander people. This is part of our commitment to the delivery of culturally sensitive care.
We have a suite of screening tools that are used within the service to identify risk of aggression, falls, pressure areas, nutrition and hydration issues. I can show you these in the medical record. I can also show you audits of the use of these tools.
How does your service ensure the delivery of comprehensive care?
The YES survey is used to understand the consumer's views on our delivery of comprehensive care.
You'll be able to observe one of our multidisciplinary team meetings, which will make it clear how we involve consumers and carers in the delivery of comprehensive care.
Where possible, we ensure consumers sign their care plans to demonstrate our commitment to consumer involvement and shared decision-making.
How does your service minimize consumer harm?
We have policies that identify tools that are used to support practice in the screening and assessment of risk, and these are used consistently across our service.
These policies identify the appropriate screening and assessment tools for pressure injuries, falls, or nutrition and hydration issues. These tools are integrated into our assessment documentation and form part of our electronic medical record.
We have consumer and carer information available that explains how they can be involved in the delivery and evaluation of care. This information is provided on admission to the service. We also have the REACH program to involve consumers and carers in escalating care.
we have worked hard in the service to prevent and manage self-harm and suicide. This includes training activities, audits of our risk assessment practice and close observation procedures.
We have also ensured that staff have had training in preventing and managing aggression, including de-escalation techniques, and I can show you evidence of staff participation in this training.
We have also done a lot of work on reducing the use of seclusion and restraint. I can walk you through the quality projects we have undertaken in this area. I can also show you data on the use of seclusion and restraint.
The assessors will ask you questions about our approach to comprehensive care, how we gain access to the policies and procedures that guide our practice in relation to comprehensive care, the training you have received about the provision of comprehensive care and how we work to improve our systems for the provision of comprehensive care. What other evidence could your service provide to meet this standard?